An alarming surge in a dangerous strain of Group A Streptococcus gas infections is unfolding across the United States, with incidents more than doubling between 2013 and 2022. The Centers for Disease Control and Prevention (CDC) has reported that this invasive form of gas, once commonly associated with mild illnesses like strep throat, has begun causing life-threatening complications such as sepsis, necrotizing fasciitis, and streptococcal toxic shock syndrome. The data reveals a disturbing pattern. Not only is the infection rate climbing, but it's doing so most dramatically among populations already vulnerable, those experiencing homelessness, residents in long-term care, and people who inject drugs. This isn't just a seasonal uptick. The increase is sustained, geographically widespread, and deeply concerning in both its scope and impact. The CDC surveillance covered 10 states, including New York, California, and Maryland, but experts caution this may represent a larger national trend. With more than 21,000 cases of invasive gas identified during the study period, leading to over 20,000 hospitalizations and nearly 2,000 deaths, the implications for public health are severe. Even more disquieting is that these numbers don't fully account for unreported or misdiagnosed cases, particularly given the way gas can mimic more benign illnesses in its early stages. Doctors are now sounding the alarm about the deceptive nature of this pathogen. In its invasive form, gas can spread rapidly through the bloodstream or deep tissues, often with subtle or delayed symptoms that may mislead even experienced clinicians. This makes timely diagnosis a challenge, and in the absence of quick intervention, the consequences can be fatal. Physicians have emphasized that early antibiotic treatment is key, yet many infections are missed because they are mistaken for less dangerous illnesses. Adding another layer of complexity is the aftermath of the COVID-19 pandemic. Immune systems compromised by recent viral infections, along with reduced vigilance in screening and diagnosis during the pandemic years, have likely contributed to the gas resurgence. Hospitals across the globe, from the northern to the southern hemisphere, have reported parallel spikes in cases over the past 2 years. The post-COVID landscape has created an immune vulnerability that this aggressive bacterial strain is now exploiting. What is especially troubling is the lack of a vaccine. Despite gas's capacity to cause widespread illness and death, there is currently no approved vaccine to prevent it. This leaves the medical community with limited tools beyond antibiotics and supportive care. The infectious disease community has been calling for vaccine development for years, yet progress has remained painfully slow, and oversight now becoming increasingly costly. The connection between gas and socioeconomically disadvantaged populations cannot be ignored. Infections are disproportionately affecting those living in poverty, battling substance abuse, or suffering from poor access to healthcare. These are individuals who already face a higher risk of infection due to factors like poor hygiene, compromised skin integrity, and shared drug paraphernalia. This trend starkly illustrates how public health is inseparably linked with broader social conditions, and how pathogens exploit gaps in our healthcare and support systems. Compounding the crisis is the rise in pediatric cases. Children aged 4 to 13 were the most commonly affected demographic in the latest wave of strep throat infections, which in some cases progressed to severe invasive disease. The rise in pediatric deaths is a grim reminder that even previously healthy children are not immune. The fact that the 2023 infection rate was 30% higher than the pre-pandemic peak in 2017 should be enough to prompt national attention and action. Without a preventive vaccine, mitigation efforts must focus on public education, rapid diagnosis, and responsible antibiotic use. But the public also needs to recognize the gravity of this infection. Strep throat may seem like a routine childhood illness, but when caused by an invasive strain, it can become a medical emergency. The rapid escalation of these cases and their potentially devastating outcomes demand vigilance. People must take even minor symptoms seriously, especially in high-risk settings, and stay home if they're sick. Hand hygiene, avoiding shared utensils, and covering coughs and sneezes are small actions with big consequences in curbing spread. Parents need to stay in close contact with pediatricians, particularly if their child presents with a sore throat, fever, or unexplained fatigue. Delaying care by even a day can mean the difference between recovery and a life-threatening infection. This is not a situation that can be brushed off as a statistical anomaly or an exaggerated media scare. We are seeing a clear pattern of rising incidence, increasing severity, and significant mortality. Without widespread awareness, early treatment, and improved infrastructure to care for the most vulnerable, this trend is poised to continue or worsen. The current reality is stark. An aggressive bacterial threat is gaining momentum in the wake of a weakened immune landscape, preying on systemic gaps and personal inattention. The medical community has raised the red flag. Whether or not it's heard in time will determine the trajectory of this emerging crisis.